Welcome. This module we are going to be focusing on, it's Psychological Counseling 3. The course code for this module is PC30D3. Let's look at the course content, meaning what is it that is contained in the course or that which we're going to cover. This module covers psychological counseling techniques, key elements of social psychology, HIV palliative counseling, counseling orphans and vulnerable children, counseling affected families, members and bereavement counseling, religious or spiritual counseling, principles suitable for people living with HIV/AIDS, affected family members, legal and ethical principles of HIV/AIDS, counseling, designing a counseling-friendly consultants room for a VCT center. The learning outcomes. Out of this module, we would like to see an increase in the awareness and understanding of counseling in HIV matters. We want to see our students developing and being equipped with skills and competence in counseling techniques useful in HIV management. We would also want to see students being able to apply useful legal and ethical requirements needed in HIV/AIDS counseling. We also want to see students being able to practice self-reflection through associated readings and a series of exercises in order to arrive at a greater awareness of your own moral values and the level of integrity at which you wish to lead your own personal and professional life. We want to see our students becoming more sensitive to consequences of their decisions and those of others. We would also want to see our students starting to get an understanding of the necessity for relying on personal values and how these may be integrated in the world of HIV/AIDS. And also we want to see the development and improvement in skills essential in combating HIV/AIDS through the use and application of learned concepts and knowledge on HIV/AIDS. Just some introductory overview. There is no doubt that the scourge of HIV and AIDS has many members of our societies affected and infected by AIDS who need counseling in order to cope with the fear of the unknown. These members, thus adults and children alike, suffer from emotional turmoil, have fear, grief, poor performance, nightmares, headaches, and a myriad of other disorders which require attention for those caring for them. Their fears border on issues such as who will take care of them and why they are affected and inflicted. Some have anger and bitterness towards family members and God. Counseling is thus an essential tool which gives them the opportunity to voice out their feelings and fears, which makes them feel heard and understood. Those who receive effective counseling are able to smile again. Their performance improves, they show tremendous change towards life without their loved ones and their disease. Psychological counseling presents an opportunity to help those afflicted and affected to cope with HIV/AIDS and is an essential component of HIV management. The study of this module therefore prepares students or any readers with the basic techniques of counseling which are essential in HIV/AIDS management and in any situation that assists members of our societies cope with life challenges. Furthermore, you as a student are encouraged to continuously consult libraries and the internet in your quest for gather recent information on HIV/AIDS. This manual contains only guidelines as HIV/AIDS and its treatment is on an ongoing matter. I cannot stress this concept enough. There's a lot of development in terms of counseling, and it's very important that students keep themselves updated continuously. Let's quickly look at our assignments. This module is a year module and therefore we are expected to do 8 assignments. So the first assignment, using concepts of social psychology, explain the role of social psychology in HIV/AIDS counseling. So basically what you need to have is to have a good understanding what is social psychology and how this plays a role in HIV/AIDS counseling. Assignment 2, using concepts of social psychology, explain the role of social psychology in HIV/AIDS counseling. Okay? And assignment 3, discuss the ethical standards that guide work of counselors and explain why ethical standards are needed in counseling. So first and foremost, like I've said in previous presentation, it's very important to identify keywords. Before we talk about ethics or ethical standards, first and foremost, you must have a very good understanding of ethics. What basically are ethics, and how these can guide you in counseling. And also, obviously, we need to understand what are those requirements. If you are a counselor and you are counseling, what ethical standards are you supposed to adhere to in order to protect the integrity of the counseling career? Assignment 4, the initial diagnosis of HIV/AIDS is still perceived by many patients as a life-threatening event, with over 1/3 of cancer patients experiencing clinical range anxiety and depression. Using principles of palliative care, elaborate how a counselor can assist a client to deal with depression. In your answer, define depression and highlight the signs and symptoms and the causes of depression in a person living with HIV/AIDS. Assignment 5, the person living with AIDS faces physical tragedy of terminal illness compounded by the religious, spiritual tragedies of alienation and oppression. Discuss the religious and biblical principles which can be used in counseling people living with HIV/AIDS. So again, before you attempt this assignment, you need to acquaint yourself with literature concerning religious and biblical principles. And also you need to have a very good understanding of this whole concept of spirituality and HIV and AIDS as provided for in your manuals and also other readings. Assignment 6, discuss the role of HIV counseling and testing in the fight against HIV in Namibia. What this simply means is that first and foremost, you need to understand the fact that HIV counseling, previously it was known as voluntary counseling and testing. Now there's been a change to HIV counseling and testing. For a very long time, HIV or voluntary counseling and testing has been seen as an entry point to prevention, treatment, care, and support. Hence, it's very important to really, when you are attempting this assignment, to look at what role does counseling play when it comes to the prevention element, what role does HIV counseling play in terms of treatment, care, and support. Because you must remember that upon the diagnosis of an individual, there are two things. It's either you are tested positive or you are tested negative. The moment someone is tested positive, then they can actually go for further tests to determine whether they can be put on medication and also go through ongoing support. If somebody is tested negative, what it means is that they have to adopt on those behaviors whereby they should stay negative. So whatever the case may be, whether the result is positive or negative, it works to the advantage of the client and also to the entire country, to the entire region, that those who are positive must not continue to pass on the virus to other people, while those who are negative must stay negative. And by so doing, we can actually create an AIDS-free generation. Assignment 7, a counselor plays a fundamental role in the counseling process. Discuss the qualities and skills needed to make a good enough counselor. What this question is looking for is that as much as counseling is such an important institution or an undertaking, much of what happens in the counseling session depends on the qualities and skills of a good counselor. Therefore, it is very important that students acquaint themselves with literature around the making of a counselor and also the skills that one needs to be a good enough counselor. And the last assignment is discuss bereavement counseling and how a counselor can apply the 5 stages of grieving by Dr. Kubler-Ross. You realize that Dr. Kubler-Ross played a very important role in helping us to understand what it is that people who have been diagnosed with terminal illness and are facing death go through. as well as those who are looking after them. And out of that came the 5 stages of death and dying. That is denial, anger, bargaining, depression, acceptance. And finally, there was another stage which Dr. Kubler-Ross developed called hope. Therefore, in each stage of development, how can a counselor apply these stages in order to help during the process of counseling of a client? And in conclusion, students are strongly advised to read extensively before attempting any assignment. My contact details are readily available. Feel free to contact me. And I wish you all the best in your studies. Thank you.